Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I'll start with a couple of announcements. First of all, our conference is coming up November 8th through 10 right here in Columbus, Ohio. And in addition to an amazing roster of speakers, which you can take a look at wellnessforumhealth.com, we actually give you back a certificate for $500 if you come. So this is the only conference in the country, I believe, where you buy a ticket that costs less than the money we give you back to invest in some of our programs if you choose to. Anyway, some of the people we have coming, we're going to screen the movie Code Blue, and Dr. Saray Stanzik, who produced the film, is going to be here to discuss it. She's a wonderful physician. I think you'll enjoy hearing what she has to say in the movie. I'm in it, just to be clear. I think you'll really like the film if you haven't already seen it. Dr. Tom Seafried is coming. He wrote a fabulous textbook called Cancer as a Metabolic Disease, which I use in several of our courses here at Wellness Forum. He's going to talk about his work in keeping even terminal cancer patients alive by turning it into a chronic condition rather than trying to get rid of the cancer, which sometimes means you get rid of the patient too. And then we have Chris McGreal coming, who has written a fabulous book on the opiate epidemic. I finally got a chance to sit down and read it cover to cover. I had skimmed through it before I asked him to speak here, but I sat down to read the book cover to cover, and it was like reading a John Grisham novel, only it really happened. This stuff really happened, and it's pathetic and terrible that it happened. The bad news is that I don't think that our elected officials and our government agencies have really latched on to the types of strategies that would prevent such a thing from happening again, but I really encourage you to be here. He's going to be a fascinating person to listen to. Certainly his book was one of the more fascinating books I've read in a long time. Another thing is, it is Breast Cancer Awareness Month. It is October. We're in the second week of the campaign right now, and I'm very excited about how many pledges we've already gotten and how many women are signing the pledge. So what we're asking women to do, something constructive to really reduce their risk of breast cancer, is we want women to commit to eat more plant foods, exercise more, work on attaining a healthy weight, and limit alcohol. And those are 4 strategies proven to reduce your risk of breast cancer, much better than eating pink M&Ms and pink chicken buckets, right? So if you want to sign the pledge, send me an email at pampopper@msn.com. We give every woman who signs the pledge a free online lecture on breast cancer, how to reduce your risk of breast cancer, and also a $100 certificate good towards some of our online courses. And if you get 100 women to sign the pledge, you get an extra $100 certificate. So we're going to incentivize people to make commitments that are really healthy and to help other women do the same thing. I'm really excited about this because in the past and during October, mostly I've just complained about all the stuff that everybody's talking about that isn't going to make a difference in public health, and that's my whole mission here, showing up every day at work, is to improve public health. So I'm really excited that we're doing something that contributes to improving public health. I want to respond to an email that I got from a person, and I'm going to summarize the email. This individual watches this channel, and what she took issue with is that I've made the comment a few times about it's easy to adopt a whole foods plant-based diet. And what this person explains in her email is that a couple of years ago, her and her husband started eating a more plant-based diet, and they found it very difficult to do. There are several issues, one of which is that she doesn't like a lot of the foods that she's eating. She has a limited palate. And so my response to this, and I think this is more people than we know that feel this way, is that first of all, let us or somebody like us help you do this right. And by right, I mean, first of all, we don't want people eating foods they don't like. Our goal whenever somebody leaves this office or consults with us by phone is to work with our dietitians and come up with meal plans and foods, something that they're really going to enjoy looking forward to eating. There is no mandate to eat kale and green apples and to choke down things you don't like. It's a bad idea, and we don't recommend that. It's not a path to sustaining a health-promoting diet. So the first thing is, no matter how limited your palate is, and according to what I'm reading here from this woman, she feels like her palate is very limited. No matter how limited it is, we can help you do this and do do it right. That's the first thing. The second thing is it doesn't necessarily have to be vegan, so perfection is not what we're looking for either. So when I see people that are falling in and out of doing this diet, what that says to me is they're trying to attain a level of perfection and or eating foods they don't like, neither of which is sustainable. So it doesn't have to be hard. I will admit that it's hard if you don't know what you're doing. It was hard for me in the beginning because I didn't know what I was doing. But if you have the right type of instruction, this can be fun and health promoting and sustainable and include foods that you like. Okay, so let us help you do that. I think that's important. All right, I have a couple of articles to share with you today that are kind of related to each other. And the first one is an analysis that shows that eating more plants is healthier for you. I don't think you're shocked to hear that coming from me, but researchers looked at the associations between changes in the diets of plant-based eaters during a 12-year period in over 49,000 women in the Nurses' Health Study and over 25,000 men in the Health Professionals' Follow-Up Study. The study showed that people who ate an unhealthy plant-based diet had a higher risk of total and CVD mortality, while those who improved the quality of their plant-based diets had a 7 to 9% lower risk of total and cardiovascular disease mortality. More dietary improvement resulted in increasingly lower risk. Increased intake of refined foods and sugar led to worsening outcomes, which is one of the things that I talked about last week in one of the video clips, while adding more fruits, vegetables, unrefined grains, and nuts led to improved health. To interpret the data to what this would mean, like if you're going to follow this and say, okay, I'm eating a plant-based diet, but I'd like to do it a little bit better and reduce my risk even more, what would this mean? Reducing consumption of unhealthy plant-based foods while adding 3 or more servings a day of healthy whole plant foods can make a huge difference in your health. So one thing that I think it's important that people adopt a health promoting pattern. In other words, I've never bought this baby steps nonsense. I think it takes forever for people to see differences in their health, and you still have a lot of bad stuff around the house. I could give you a lot of reasons why I don't like that idea. But the other side of it, as I just mentioned, is this idea that it has to be somehow perfect in order for there to be a positive effect is absolutely ridiculous too. So anyway, several take-home points from the study that I want to point out. One is that more plant food is better. Anytime you see this dose-dependent effect on health outcomes, that tells us that we're on the right track for things. Now, just avoiding animal foods is not enough. I said this last week. We have a lot of people that are in the avoiding business, but not the choosing business, and you really got to move over to the choosing business, eating more whole plant foods, not just talking about what you're not eating anymore. So a lot of people are eating processed foods, a lot of non-dairy ice cream and non-dairy cheese and meat substitutes and candy bars with soy protein in them, and that's really not a plant-based diet at all. And it makes the numbers look terrible, or the results look terrible in studies where vegetarians or vegans who are junk food eaters are measured against animal foods eaters, because they really don't come out that far ahead, if at all. And then the other thing I'll point out is it's never too late to change, because this is a 12-year study in people who were a little bit older, and as they got older, they got better at the diet and their health outcomes got better too. So no matter how old you are, it's never too late to start doing better. So our pyramid is a wonderful guideline for how to eat a health promoting diet. There's a place for almost everything. I mean, there are a couple things we think people should just get rid of, like the dairy and oil. But other than that, there's a place for everything. Even birthday cake. I have a birthday coming up in a couple of weeks, and I'm probably going to have some decadent vegan dessert, but it'll be terrible. I mean, a little piece of something. So there's a time and place for it. But every day is not my birthday, darn it, so I don't get to have that stuff every day. All right, now related to that, here's another article I want to discuss, and this goes to talk about nutrition often focuses on deficiencies. I get emails like this every day from people asking, if I eat a plant-based diet, am I going to be deficient in omega-3s or choline? I wrote an article and put it in our newsletter not too long ago about choline deficiency, which everybody is being frightened that they're at risk of now, or vitamin C and so on. Well, well-fed people are not suffering from nutritional deficiencies. They're generally suffering from excess, too many calories, too much fat, too much protein, too much junk, etc. Too much of everything except for whole plant foods, right? Too much of that would be a good thing. Meanwhile, we have a different and very real deficiency, which was described in Lancet Planetary Health as a, quote, global deficiency of nutrition education and physician training. Author Stephen DeVries describes this as, quote, the low-hanging fruit that remains on the vine and if picked could result in vast improvements in public health. Now, according to the 2019 Global Burden Disease Study of 195 countries, diet is the leading cause of death, responsible for even more deaths than smoking. DeVries rightly states that if medical education were focused on the needs of patients, nutrition would be front and center, but it's not. DeVries' article was a commentary on a review of 24 studies of nutrition as part of medical school curriculum in the United States, Europe, Middle East, Africa, Australia, and New Zealand. Medical students universally in all of these areas rated their education about nutrition, knowledge of nutrition, and their confidence in their ability to help patients with nutrition counseling is very low. What was interesting is that in spite of the way that these people felt about this, medical students rated their interest in nutrition as remaining very, very high. In fact, research has shown that medical students enter medical school with a very high interest in nutrition, which diminishes over time. I don't think that that's hard to believe based on the fact that they don't learn much about it. The mentors that they have in school, they don't see them focusing on it at all. The review notes that there are so many obstacles to improving nutrition education for doctors, and they include things like faculty members are perceived as having not much interest in it. They don't have much expertise, actually. The curriculum is of low quality, it's not prioritized, and medical students don't observe nutrition counseling during their training. They don't watch any other doctors do it. The impact of this situation is very broad, and it affects not only the health of individual patients, but also planetary health as well. The researchers note that there's the growing awareness, which I'm happy to see, that the importance of plant-based eating is not limited to individual people and their health, although I think that's the primary reason most people would consider it, but it's very good for planetary health as well. An important irony pointed out by the authors of the review is that while physicians are given little education about nutrition, research shows that patients rely on their doctors for information, and doctors' advice about nutrition, to the extent that they give it, has a positive impact on them. They note that while nutritional interventions are best delivered by a team of health professionals, right now the big problem with doctors is they don't even have enough basic training to start an informed conversation about it and know how to refer somebody to a professional. Proposed solutions in the new review include integrating nutrition into lectures on disease causation and treatment, supplemental and online nutrition curriculum, teaching kitchens, and training clinical mentors. We're a long way from this happening, unfortunately. But the first step in solving any problem is identifying it, and I think that the authors did a very good job of showing that it's a worldwide problem. In other words, it's not just limited to the United States. And I think the good news we can take from it is if medical curriculum started to include a focus on nutrition, it sounds like, and I've certainly seen this in the medical students I've had the pleasure of knowing since I've been in this business, medical students would welcome that and embrace the idea of learning about it. We've had quite a few come here to spend time with our staff and learn about nutrition. All right, that's all for today. As usual, I'll pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news.